Hello, my name is Christopher Mitchell, and today I will be presenting information about the structures of the eye as well as the functions of the eye, in addition to disease processes that can occur in the eye for both the adults and the older adult populations. Clinical manifestations, areas affected, diagnostic studies, nursing care, as well as education related to the disease processes will be discussed in this presentation. Before we get into that, I wanted to show you guys the structures of the eye, which I have a diagram here that I did. We have the sclera, the iris, the cornea, the pupil, the lens, the ciliary body and muscle, the conjunctiva, the vitreous body, the retinal blood vessels, the macula, the optic nerve, and the retina. So to further explain the functions of these, the sclera, located here, protects the internal structures of the eye, and the iris, which is right here below it, provides the eye with its color. The pupil allows light to enter the eye, and it regulates the amount of light entering it. The cornea, which is located here, reflects light rays to help them focus on the retina. And the lens helps bend light rays for increased focus on the retina. The ciliary body and muscle, located here, facilitate contraction to allow the eye to focus and to secrete aqueous humor. The conjunctiva forms pockets under the eyelids and covers the inner surfaces of the eyelid, extending over the sclera. The vitreous body fills the posterior cavity of the eye with a gel-like substance, which is here. The retinal blood vessels help provide the eye with blood supply and oxygenated blood. The macula functions the central visual field. The optic nerve provides the eye with it functions as the visual pathway to the brain. And the retina receives light from these structures here, in which regulate the amount of light that the retina gets. All right, so we're gonna go into the disease processes associated with the eye for the adult and the older adult population. Firstly, glaucoma is structural damage within the intraocular part of the eye from elevated pressure that can occur in the adult population. Clinical manifestations include blindness without proper treatment, and a diagnostic study concludes that non-Hispanic whites have a lower prevalence of glaucoma than non-Hispanic African Americans. Strabismus is a condition that is congenital in which both eyes cannot focus on an object at the same time, generally causing cross-eyedness appearance. And clinical manifestations include impairment of the extraocular muscles. And a diagnostic study includes the importance of periodic visual screening for young, newborn, and preschool age children. Retinopathy can lead to blindness resulting from retinal blood vessel changes, and diagnostic study has concluded that retinopathy is the leading cause of blindness. Clinical manifestations for retinopathy in the adult population include diabetic retinopathy, macular edema, and hemorrhage. Going into the older adult population, firstly we have cataracts, which can form visual impairment in many older adults, and it's really common in older adults. And it's defined as the opacity of the lens that is increased, causing lack of light regulation entering the eye. Cataracts are one of the most common disorders of the eye, and common clinical manifestations based on research studies include gradual loss of vision, blurred vision, and increased sensitivity to light. Macular degeneration is caused by the damage of sharp and central vision and is associated with older age. Diagnostic research identifies two types of macular degeneration, including both dry and wet, and it is one of the leading causes of blindness in the US. Abnormal blood vessels can form behind the retina, leading to fluid and blood leakage, which is usually described as wet macular degeneration. Presbyopia is impaired near vision occurring in middle age to older adults, causing lens elasticity loss. Clinical manifestations typically include the use of glasses to help this population see things up close and to read. And diagnostic research concludes that this typically results in progressive decline for near to far vision accommodation. Going into more nursing care and treatment for these eye disorders, starting with glaucoma, nursing care includes educating about adherence to medications, evaluating progression of any visual disturbances, assessing safety in the home, and promoting regular follow-up appointments. Treatments often include laser treatment, teaching about how to properly manage the condition by allowing demonstration, surgery, and medication drops that lower the pressure within the eye. Nursing care for strabismus includes educating on eye exercises and encouraging clients to utilize glasses. Treatment and care typically include surgery, injections, eye drops, and glasses. Retinopathy is commonly caused by complications of diabetes, and the best course of nursing treatment is educating clients to adhere to their medications and dietary restrictions for managing their diabetes. Medications called anti-VEGF drugs are typically prescribed to treat retinopathy, as well as surgery and laser treatments. Cataract removal is a treatment used to fix cataract-related visual disturbances, in addition to the use of glasses. Education for cataract management would include safety in the home due to visual disturbance. Nursing care includes safety assessment and advocacy for those to have their needs met and the potential problems with everyday activities due to vision loss. Macular degeneration does not have any treatment and is associated with aging, and nursing care would include educating on importance of a healthy diet, refraining from smoking, and getting regular exercise. Presbyopia is most commonly treated with the use of eyeglasses that allow for seeing close up, and it is essential for the nurse to educate on the importance of regular eye exams as well as assessing safety in the home. Thank you.